content discussed on this program is often medical in nature and is used for informational purposes only. No content discussed should be taken as medical advice. Please consult your healthcare professional for any medical questions.
Hi, I'm Tori McGee, and this is the Rapid Recovery Report sponsored by ROMTech, the modern technology of rehabilitation. So we'll be doing this series every once in a while. If you're following us on our social media, you'll get alerts when we have brand new streams. But if you're new here, basically, we talk to different guests, surgeons, patients, insiders here at ROMTech to talk everything from wellness to health and our portable Connect device. So if you've never seen it before, this little beauty here is our portable Connect. It's a high-tech recovery device, and it's geared to get patients moving and on the road to recovery faster from injuries and surgeries. So if you want to learn a little bit more about us, visit us at www.romtech.com and follow us on our social handles that are listed in the description below. So today we've got a really fun guest, and let's get right into it.
All of the red tape and paperwork in the business of medicine can cause a divide between doctors and patients. Dr. Shivaji Nalamothu is able to maintain a solid connection between himself and his patients in spite of the red tape problems by always looking for better ways to do things. Dr. Nalamothu always believes that you must ask the right questions and listen to the patient. Being a coach, Dr. Nallamothu uses the same methods to motivate and inspire his patients as he does his athletes, and that is a winning strategy every time. Dr. Nallamothu, we salute you.
Hey, Dr. Nallamothu, so great to have you here.
Oh, great to be here. Thank you for inviting.
Yeah, so I understand you got your medical degree from Michigan State. You did your residency at Michigan State, and now you're the founder of Michigan Center for Ortho. So Michigan through and through, huh?
Yeah, I'm only taking about 3 months off and went to Vegas to do our trauma rotation during residency. Otherwise, I've been here since 1979. Came here in 8th grade from Tennessee, and I've been here since. Loving it up here, and it's nice to visit the warm weather, but hey, we're in Michigan.
Yeah, well, I mean, the Vegas desert's a real hard sell.
Yeah, get pretty hot. Even in the swimming pools, you come out sweating.
Oh yeah, yeah. You never really get to cool down there in the summer, so I don't blame you for sticking around in Michigan. Now, I understand that your father was a psychiatrist, right? And
yes,
he thought you'd be a great orthopedic surgeon?
Yeah, he actually, I'm actually supposed to be a villager and a farmer in India, but my dad decided to come here and go to medical school, and he became a psychiatrist. And then we came up to Michigan, and growing up, yeah, he's, in our family, there's a lot of physicians, and it was almost like it's a given you're going to go to med school. And so when we were talking about what kind of medicine to do, he kind of understood right away you should go into, medicine where you can use your hands, like in surgery of some type of surgery. Yeah. So this is how I ended up in orthopedics.
Okay. So you must have liked to fix things and build things as a young kid, right?
Yeah. Whenever something broke in the house, I was always called, and I would look at it. Either I threw it away or I tried to take it apart. And if I could fix it, I could fix it. If I didn't, it just went in the garbage. But I love doing that kind of stuff. And even now I kind of look at things and trinkets and try to fix things. And
the doctor, Mr. Fix-It. I like it.
Yeah.
So there has been a shift, it seems, right, to using surgery centers for ortho procedures versus like a hospital stay. And that's been over the past few years, I would say. So what is your preference, and why is that?
Well, different patients do better in different places. So if it's a sick patient, an elderly, they need help, they need to stay for a day or two to get up and move around and rehab, then the hospital is probably the best place to go. Otherwise, younger people, when you're doing a 50-year-old that needs a knee replacement, they want to go home, right away, the same day. They want to start therapy right away. They want to get aggressive and start moving and get back to their life and get back to work. And so the outpatient center is perfect for them. You do the surgery, you're home 2-3 hours later, and they love it. It's efficient. It's clean. It's just, the efficiency is really good. The staff there actually is really well trained on how to get people up and the way they talk to them, little subtle things like, hey, it's time to get up, not do you want to get up? and let's start moving. The family's there to watch. We got the walker right there, and they walk right to their car, get in, and go home.
Awesome. Yeah, I think that's what I'd prefer, most definitely.
Yeah, yeah.
So how important is prepping before surgery for patients? Meaning, like, how do you prepare patients for surgery? Like weeks before versus days before or immediately before?
It's actually months before, because when we first see the patient, they complain of knee pain, but you can't board them and start talking about surgery, because that's not what the right thing to do is. The right thing is physical therapy, anti-inflammatories, injections. So that talk actually starts way back when we first meet them. We can look at the x-ray and assume you're going to end up in a knee replacement, but that's not the first step. So we go through these steps, and each time we see them, we talk about the knee replacement and the procedure. Then they start asking more questions, understanding what their disease process is. And then they got better questions, more in-depth questions. But once we board them for surgery, we talk to them for, 20, 30 minutes in the office, and that's just the beginning. I actually require the patients to come to my office a week earlier, and we have like a 50 or 60 slide presentation for all of them. They come in a group, and they get to a little camaraderie. They talk about how they're going to do better than the other patient next to them. And when they meet in the OR, or in the pre-op, they actually know each other and talk to each other. And some of them become friends afterwards. But that process of having them come to the office and doing that presentation is huge. I mean, 50, 60 slides of just from one step to the next until you get home, and even afterwards, what they can expect. And so it's a big process to make sure that the patient knows what's happening. Even then, they still have questions.
Yeah, I'm sure. Well, I mean, the good thing is if they're making friends in class, one of them forgets something, hopefully they can call the other one and ask, right?
Oh, yeah. And we know these patients for 6 months sometimes before we do the knee replacement. So we'll see them in the neighborhood at the grocery stores, and they'll show me their knee and how they're doing, and they'll brag about how well they are.
Good, good. I mean, is there anything that you think is the most important thing to tell patients ahead of surgery?
Their biggest thing is high expectations. They think, they have a friend that said, "Hey, I had my knee and I was walking right away." That's not really what they meant. What they meant was they were allowed to walk right away. And so you have to actually tailor the expectations. So if they have really high expectations, you have to bring them down a little bit and say, "Listen, this is a major surgery. We're cutting bone, and getting into the joint, doing a replacement, cementing something in. Then you got to start the rehab." It's a huge process. And so that's the biggest thing, is to know you're going through a major surgery and you have to take baby steps, and gradually you will be that person that brags about how great they did after the surgery. But it's not an overnight thing. And people exaggerate when they get done, how well they did. And so, yeah, we got to make sure the patient knows what to expect.
Yeah, that makes sense. And I mean, we've heard from other orthosurgeons that they're seeing a trend of younger and younger patients who need knee procedures. And I assume that, you've been seeing that as well. And I also would assume that those who have really high expectations for a quick recovery are coming from younger patients. Is that right?
Yeah. Oh, yeah. And they want to get back to work. They have kids. They got
Yeah.
younger kids, and they're not 70-year-olds where their kids are 50-year-olds. And
Mhm.
so they really want to get back to doing their regular activities, working out. They want to show off, when they get back to work, and really work hard at it. And they take pride in how hard they work. And that's why the Portable Connect is actually really excellent for this.
Awesome. And I do want to get into the Portable Connect a little bit more, but before we move on, I just want to ask, why do you think that it's happening that more and more younger people are having to have knee procedures done?
I think sports participation has increased a lot, and the injuries before that we couldn't do much with, now we're having new procedures that come out that we can help them with. So we're doing more minor procedures leading to more major procedures. And as the arthritis gets worse, they don't want to put up with pain anymore. And so now when they know there's options, with marketing and things like that the companies do, now that they know there's options, they want to do something. And when we fail, anti-inflammatories, physical therapy, injections, the next step is knee replacement. And used to be, when I was a resident, they would tell patients, "Don't do anything until you can't walk anymore." Well, that's not the rule anymore. And a lot of physicians would say, you're too young, don't do it right now, wait till you're 60 or 70. But people don't want to wait anymore because they got things to do. They don't want to suffer. And there's no reason to suffer. If you can get something fixed, get it fixed. And the implants are so good right now. And the other physicians that came up with these implants, the scientists, the bioengineers, the implants are so good that they'll last 20, 30 years now. And the techniques are getting better. And, we're just benefiting from being able to do surgery on patients and helping them. And these other guys here before are, they gave us these tools. And so we get to pass it on to the patients.
We're really excited to find out about how the Portable Connect has been working for your patients. I know you just mentioned it, so can you share with us a little bit about what you're seeing so far?
Yeah, actually, patients want to participate in their rehab. They don't want to sit there. The old CPMs, you would buy this machine or rent the machine. The patient would put it up in their bedroom, upstairs, away from everybody, and they'd sit there for 3 hours. It's boring. Nobody wanted to use it. They would fall off the bed. It doesn't fit right, that kind of thing. The Portable Connect is a whole new generation of just advancements. The Portable Connect can be put in the living room, in front of the TV, where the dinner parties are, the cocktail parties are. It's right there where all the action is in the home. So they feel like they're still part of the house. We encourage them to go out and do things. And then this machine, the way it works is it puts pressure on the knee to work faster. And with the range of motion increasing over time, they kind of compete against themselves to do better. And with the iPad type of screen, the interaction is just great. I've been on it before. I've tried it. The interaction is really cool. Patients love that technology. I get to look at it in the office and see how the patient's doing every day. If they're not using it, I know when they come into the office, they brag about how much they used it. They love it. And again, they like participating in rehab. And when they do better and they're starting to walk by themselves, they know it was them that did it. And I tell people all the time, I got the easy part in surgery. It takes me an hour to do this. They got the hard part for the next 2 to 3 months. And I think the therapy afterwards, they need less than if they didn't have the Portable Connect. And so now instead of going to 3 months of therapy, they're dropping down to 2 months, even 6 weeks sometimes.
Wow. That's a big drop.
Yeah. I actually have one of the original prototypes in my office right here. And
what we lovingly referred to as the clunker.
It's the clunker, but it's beautiful.
Well, everybody has to start somewhere,
and it's a counter on it like this big.
Yeah.
It tells you how many revolutions.
Yeah, we've come a long way.
Yes.
We've come a really long way.
It's a beautiful machine right now.
Yeah. Well, I mean, the technology, the initial technology of the pedal radius and everything is still there. We've just zhuzhed it up a little bit.
Oh yeah, it's smooth. It works really good. It's I love it. Yeah.
Great. So as we're talking about things changing for the better, how do you think the business of medicine can get better in the future?
Well, there's a few things. I think the biggest thing is the scientists that right now, the research that's coming out is giving us better protocols on how to treat patients with certain disease processes. Mm-hmm. For example, I'm a member of the Marquee program here in Michigan. So Marquee is MARCQI. It's Michigan Arthroplasty Registry Collaborative Quality Initiative. So we pick a project. I know it's like this a letter soup, but we pick a project. So for example, trying to give antibiotics within an hour of the surgery. And so we shoot for that for the next few months while we're coming up with the next process, blood transfusions. So we're trying to tackle that problem. The more transfusions you have, higher problems you can get afterwards. We realize that we can let the hemoglobin drop a little lower before we have to transfuse. And we're picking more specific patients to do that. And so, things like that. So we're advancing that kind of process. So once the protocols are out there, then we get to test them. And once we test them, we know what works, what doesn't work, what works better. I mean, for example, we're all giving aspirin to patients now instead of Lovenox and Rixtra and all these other medicines. And so those advancements are happening. And I think that's the best part is we get to test ourselves against our own protocols. and we get to compare ourselves to the other physicians in our state, at least for this, and then throughout the country with research papers that come out. So that's the best advancement. And then the implants, the metals, the plastics, all that, it's always advancing. I have less to do with that because that's a different field, but we get the benefit of using this new advanced technology.
Yeah, absolutely. Are you seeing, because we've heard from other surgeons, but I wanted to ask you, are you seeing a drop in narcotics for your patients who are using the Portable Connect or using movement instead of just relying on narcotics?
Yeah. Oh, yeah. That's actually very interesting you said that. I think when the patients are more alert, they don't feel sick, they use the Portable Connect more often. And then once they get off of it, they feel better and they don't want to take it anymore. So for sure, and we also have a lot of restrictions on how much narcotics we can give. There's actually a regimen on what you give and what you don't give and how much for how many days. So that's throughout the federal government. But even using that Portable Connect, I see a difference between them and the patients that don't use it or can't get it for insurance purposes or whatever.
Okay. Now, this might be a loaded question, but where do you see orthopedics in the future? I know it's very broad.
I think we are one of the leaders in medicine in general to get better technology. We pressure ourselves and each other to do better. Because with this marquee thing I was talking about, I compare myself to the surgeon across the street in a different hospital, but I know him socially. And so we can talk in a friendly way to say, hey, listen, I've got, let's say, 2 infections. What do you do about this? Or what do you do about that? And so that brings that conversation forward without insulting each other and without being punished for it through the departments or through the hospital. So the hospitals are actually participating in this. And so they understand that we're trying to get better. And so the data is out there. I think we have like a few 100,000 people in this database right now. And we can do research off of this database. And so we're trying to teach each other and work together to do this advancement.
Wow. You know, surgeons have a reputation, right, for being highly competitive. And I feel like that's the case among a lot of folks in medicine, just because it's always rankings and everything from the minute that you apply into med school in the first place. So it's really great to hear that there's this collaborative nature going on, you know, with the Marquee program, and hopefully other places across the country will follow suit this isn't a common occurrence by now.
Yeah. No, it's really important to actually put pressure on ourselves to do better. It's easy to say, hey, you know what, I did, 10 knee replacements this month or whatever. They'll do fine. But to say, I got this evidence on the Portable Connect, how often they used it, that they're getting better quicker. They're up and moving around a lot faster. I actually have a 6'6", 270-pound guy on one right now. And he's an athlete. He played basketball in college and he loves it. And he kind of calls me and texts me, because I was friends with him in college, and brags about how good he's doing. So, patients put pressure on themselves. So do we, to try to do better.
Yeah. I love to hear it. It's great too that these people who maybe otherwise would have difficulty with traditional devices can use our device. We've tried really hard to make it inclusive of people of all sizes, short and tall and heavier set and smaller, so that everybody can sort of use it. So it's great to hear these stories of people who are loving it, that maybe fall outside of the normal outliers.
Oh yeah, and they advance at their own schedule. The better they do, the more they are allowed to do, and so we get to keep a record of that and talk about it when they come to the office.
Awesome, I love it. I love to hear those stories. So I've just got a couple more questions for you. What advice could you give to someone who's in need of a procedure and is looking for answers to their questions?
Well, look on the internet, talk to your friends. The stories that you hear are the bad stories. There's a certain percentage that are going to have some issues, but you never hear about the person that did so good that they're walking by you. They don't talk about it. So you got to write down your questions. And that's why I put them through that, our presentation, so they know what to expect. And I think a part of it is you got to ask the right questions to the right people. And then for us, we have to explain something to them.
Mhm.
and we got to explain it again, and then we got to explain it one more time because I kind of kind of compare it to me going to get my car fixed. He tells me 4 things that I got to do. I come home, my wife says, "So what do you say you got to fix?" I go, "I don't know. I don't even know what he said." Right? It's the same thing. So we can explain it to somebody. I always encourage them to bring their spouse or a family member with them. So they're going to ask more aggressive questions because patients want to make us happy. They don't want to make us upset because they're keeping us too long. So the family member doesn't care. They're there to ask questions. They'll write down these notes, and I encourage them to write all this stuff down. And then even then, they got questions. They should call us, call the office. Our medical assistants can answer questions. We can answer questions. We can get on the phone and talk to them. A lot of problems we can deal with on the phone without having to have them come into the office or go to the ER. Nobody wants to go to the ER at 2 a.m. when they can just call my office and see me in the next day,
Yeah, absolutely.
So communicate with the physician as much as possible and as much as you need. And don't feel like you're harassing us.
Listen, maybe you don't want to open that door.
I don't give them all of my phone number.
That's fair. That's fair. All right, I just have 1, maybe 2 more questions for you. So what advice would you give to a young student just starting medical school, aside from, obviously, you should be going to Michigan State?
I'm going to orthopedics.
That's right.
Yeah, probably the advice would be to have nothing to do with orthopedics, actually. I think one of them is you have to, when you get to med school, everybody's under stress and pressure. Find the most positive people in your class and hang out with them. Find the negative ones and stay away from them. There's always negative and positive people. And then you have to be one of those positive people. Hold a smile on your face whenever you can. Whenever you think about it, you got to frown, smile, because it's like in sports, right? You miss 10 3-pointers in a row. The shooter knows he's going to make his 11th shot. So if you act positive, you treat everybody positive, they're going to want to hang out with you too. And so you get that group of positive people together, and you're going to have a much better life in general forever than hanging out with the negatives. The other one would be probably, I think you got to compliment the people in your office and people around you, even if it's occasionally. The staff that works in the OR, to us, it doesn't mean much. Saying, "Hey, great job today. Thanks for getting me going so fast. And everything went really good." To us, it's not a big deal. To the people around you, even when you go home, compliment your kids, compliment the spouse, right? It means a lot to them. And can imagine someone comes up to you and says, "Hey, your hair looks great today." That makes your day. Right. So do that once in a while. And that's that positive thing. You got to stay positive.
Yeah. Well, what a wonderful note.
You gotta have fun doing this. Otherwise, why are you doing it, right? There's a lot of miserable people out there. Those miserable people, even if they're flipping burgers or working on a factory, they'd be miserable doing that too.
Right.
So you gotta find the positive people and stay with them.
Yeah, I love that. Find the joy. Find the joy in what it is that you're doing.
That's right.
Well, thank you so much. What a great ending to this interview. I appreciate that so much. So thank you so much again, Dr. Nalamothu, for hanging out with us and answering all of my questions here today. We really appreciate it. And, we really appreciate your parents having you go into orthopedics here in the U.S. so that we have the opportunity to have wonderful doctors like you.
Oh, thank you very much. We got a great team at RomTech too. So I love meeting all these guys and you. So I appreciate your time too.
Yeah, of course. All right, folks, for those of you watching, you can see Dr. Nalamothu's information below. So if you want to check him out, go ahead and visit his website or visit him on Facebook. And if you want to learn a little bit more about us, you can always check us out at romtech.com. All of our details are below in the description box, as is Dr. Nalamothu's. Please subscribe to our channel as well so you can see all of these alerts when we have wonderful guests like this on our show. And if you're interested in being a guest, go ahead and shoot us an email at marketing@romtech.com. All right, thanks so much. We appreciate it. Again, have a wonderful day, and we hope to see you soon.
Thank you. Bye-bye.
Bye-bye.